Good evening, everybody. A warm welcome to all of you from Nama Bengaluru Foundation and in our webinar series called Bengaluru Fights Corona. And as we are in the latest wave and the third wave of Omicron, and here we have a very, very interesting topic of pranic healing. And we have two expert doctors with us today. And the agenda of the evening is pranic healing as a complementary therapy for COVID-19. I think it's one of the best ways to actually also circumvent and also heal in a different way from all the bad times that we have all been through. I like to welcome Dr. Raghun Ganapathi, who is our host doctor today and will share his experiences today. A brief about Dr. Raghun is, Dr. Raghun Ganapathi is a doctor by profession and a pranic healer by passion. He is a certified pranic healer, senior certified pranic healing instructor, mentor, Carnatic vocal exponent, and independent researcher. That's a few good hats, doctor. He was impressed by the scientific and categorized format of the pranic healing courses, which were very logical and simple to follow. He started using the healing protocols, sometimes incorporating them in his medical practice, sometimes independently, and saw instantaneous results in most cases. Today, at 36 years of age, he has completed 16 years of practice and 15 years of teaching pranic healing. With his knowledge in this medical field, he correlates the condition of patient energetically and guides many other practitioners and friends in rapid recovery of critical cases. For the last 10 years, around 400 people, including patients and practitioners, have been reaching out to him on a daily basis for his guidance, opinion, medical consultation, and pranic healing. Out of these, a majority of the cases include terminally ill, critical, various cancer, or patients with irreversible chronic ailments. Serious and non-standing psychosomatic cases are also referred to him. The COVID pandemic put his leadership skills to test. Many practitioners and healers look forward to his opinion on the newly created healing protocols and groups for pranic healing. These groups consist of healers from across the globe and cater to infected patients from US, Europe, India, and South America. He has seen more than 900 COVID cases, from mildly symptomatic to the ones with severe complications that include comorbidities. Dr. Raghun has been working with about 8 groups, each consisting of 5 to 6 healers, thus regularly guiding about 45 to 50 healers in the last 2 years. Now that's a great bio, doctor, and we thank you for all the work that you do and for all the healing that you have done in these difficult times. And we welcome you to this Nama Bengaluru series, webinar series, and it's a pleasure to have you with us today. And I welcome you and invite you to address the participants of the webinar today. Thank you, doctor.
Thank you. Would you also want to introduce Dr. Kshitij at the moment?
Please, yeah. Also, we have today with us Dr. Kshitij Nadkarni, MD, General Surgeon, who has worked with private hospitals and now has his own clinic in Mumbai. He's based out of Mumbai. He is also a certified pranic healer, and he's a certified pranic healing instructor and a medical consultant for students of senior level certification in pranic healing. Dr. Kshitij now combines the knowledge of pranic healing in his day-to-day practice. He has been in the field of pranic healing for around 20 years now as an instructor and a healer. As a pranic healing instructor, he organizes classes in India and abroad. Welcome, Dr. Kshitij, and it's very nice to have you among us. And as we go ahead, I think you will join us, starting with Dr. Raghun, and then we will go to you, and then we'll come back again and then close with Q&A. Thank you. Thank you, doctor.
Thank you so much.
Thank you, Mr. Vinod. Could you remove your picture so I can share my screen?
Yes, I'll stop sharing.
Thank you. So, welcome everybody. Thank you for joining on time so that we could address the topic of the day. So, I'm Raghavan. I used to live in Mumbai, but right now I am based in Amsterdam, Netherlands. And the last 2 years have been the most busiest times with regards to number of healings that we have done, or number of cases that we have dealt with, or amount of people who have approached somebody like me who has been seeing cases and patients and counseling and consulting with regards to not just healing but also the regular way of therapy. So today I'm going to take you through a little journey on what pranic healing is, and then also my esteemed colleague Kshitij would help us in sharing his wisdom on how he finds this system unique in his practices. And then I would show a small snippet on how we could effectively bring some healing and accelerate the healing of people during the COVID-19 pandemic. So pranic healing is actually a very ancient science of art of healing, which has been there around for long time, but the science behind it was never discovered in the past. Energy master Choa Koksui, who came from Philippines, he actually rediscovered the whole thing, and then he labeled it as pranic healing. So today, if you know pranic healing, is because of our teacher, Master Choa Koksui, who experimented for more than 20 years before bringing out pranic healing to the world. It is a no touch, no drug, no pain therapy, I say, because we do not even use needles like in acupuncture or acupressure. We do not even touch the body of the person, but we work on the aura and the chakra of the person using transference of energy. So the major factor here is you need a healer, you need somebody to receive healing. And we have something called distant pranic healing. So we do not even have to have the physical presence of the healer and the patient in the same room. It could be done at a distance. So there are many principles behind which we follow and practice or establish our system of pranic healing. Number one is the energy that each one of us have, right? This energy is universal. In Sanskrit, we call it prana, right? If you go to, say, an acupuncturist, they would talk about energy in the form of chi. They would say, madam, the chi to your kidney is not working. That's why you have this problem. And if I can activate this point, it will rectify your problem, right? Something like that. So each country, each language has referred to it as differently. Like in Japan, they say Reiki, which is similar, right? The ki is the different term for prana. So Master Choa specifically wanted to name this system pranic healing, referring to the ancient wisdom of this healing technology which arises from India. So he stuck to the word prana in the title pranic healing. Now it involves a healer who would transfer healing energy to the body of the patient, and the patient has to be just willing to receive to become better. Now in this, Master Choa spent around 20 years researching and cultivating this system, where he could come up with scientifically arranged protocols, which is very similar to going to a medical class and understanding the physical body. Just that in pranic healing, the healer would understand the person through the energy aspect. That's the major difference in what we do as healers and what I do as a doctor, right? Me and Kshitij here are trained in treating the physical body. We understand how the physical body works, the muscles, the muscular system, the locomotor system, the respiratory system, the various systems. But simultaneously, we also learned how does the energy manifest around us, right? And that wisdom came from Master Choa Koksui. He was not just a healer, actually. He was a businessman. He was a chemical engineer by his background. He ran several big businesses in Manila, and he was also an international lecturer in the business school in Philippines. He authored 24 books which are translated into 21 languages today. Pranic healing is spread to almost 90 plus countries and practiced as an established organization throughout the world. Millions of people use it, and we use it in our practices. People like me, doctors like me, we use it in our day-to-day practice. Many times there are cases which will come to me for therapy, and they would see a poster of the chakras or aura or something, and that's how they would say, oh, what do you do other than this? And then we have an opportunity to explain to them about healing. Or many times people come to me for healing and then end up also taking medical opinion. So it works both ways. I always say a doctor can really be a better healer because the doctor knows the physical body already, and he only has to know the energy principle behind it. And that combination is really a winner, because you can treat the person from both ways, and that combination accelerates the process of healing, right? So his aim, Master Choa's aim, was to provide techniques to create a healer in every household. That was his life motto, and he traveled the world for that. Today, pranic healing has spread, and people like me who are very science oriented, like something which is not visible, like energy, is because of the scientific, categoric and systematic approach that Master Choa used to teach these techniques. In fact, Dr. Kshitij and me are also instructors for this technique today, and we have traveled all over India to many cities and towns where there was no concept of energy, and then we could introduce it and bring up pranic healing centers and instructors who today are teaching it without us going there anymore. That kind of a level of development that we have come to. Now, the energy that I've been talking about, it's all around us, right? It's now common knowledge. The concept of energy has become common. 20 years ago, this was not that common. If people knew that there is energy, your mother would say, hey, you have to eat your food, otherwise you will not get energy, right? So people had the concept of Shakti or energy, but this existence of an aura around us and how that could enhance my ability of health was not very common. This was very secretive to a rishi or a muni or a yogi, and maybe to his circle of students. Master Choa demystified it. What did he do? He scientifically presented it so that doctors like us, who would say that you take your problem, take a pill, and then this chemical reaction would heal your cellular whatever, and then you have health. But today people like me and Dr. Kshitij are able to talk about it in a different angle is because of the scientific presentation that we teach in the courses of Master Choa Kok Sui Pranic Healing. This aura is also known as energy body. It interpenetrates the physical body. So the energy is inside as well as outside the body, and that comprises the aura. Okay? This aura has certain centers which absorb prana or energy, and those centers are called chakras. So in pranic healing, what we actually do is we try to clean this aura and the chakras, the energy centers in the aura, of the previously contaminated negative energy, or we call it dirty energy, or blocks, and replenish it with fresh revitalizing pranic energy. And the end result is what would take a long time for a healing. Say suppose you have a cut, the cut would take maybe several hours to heal. We could heal it in few minutes. If you have common cold, it would take 3-4 days to heal. You could heal it in few hours. If you have certain body aches and chronic pains, which would take months and months and months to get treated on its own, with provision of this technique of healing, we have seen that the results can be within few weeks, maybe few months. So I was always skeptical because of my background, right? So I would share a little story here. Many years ago, I was treating a case in Vashi in Navi Mumbai, and there was this lady who came to me for healing, and she had sciatica, lower back pain, right? And she said she has been having this pain for more than 10 years, and no therapy has ever helped her. So I said, why are you here? So according to her, somebody told her that pranic healing will help you. Why don't you try? So then I said, okay, auntie, I will try and heal you. She was already in her 70s and she had severe backache. So she couldn't sit for too long. She couldn't stand for too long. It will be constantly aching. She cannot lay down flat. She had tried all kinds of therapies. She had tried all kinds of healing protocols. She had done Reiki. She had done, name it, traction to, including surgeons' opinions and all. They couldn't surgically operate because of her age and certain complications. So she had to live with pain. And she comes to me and I said, I was super skeptical. I said, auntie, if nothing worked for you, why are you here? Very bad healer, right? I shouldn't be like that. I should be more optimistic. But anyway, I said, let me try. No promises, but we will try. So I tried. I knew how to heal. What is the protocol? There are step-by-step techniques that we follow. A, B, C, D, like a recipe for a nice dish. We follow A, B, C, D protocols. And I was working on her spine, on her lower back, and on her major chakras. After 20 minutes or something, she was in deep silence and peace. I had to touch her to wake her up. And then she said, are you done? I said, yeah. Auntie, look, 20 minutes already. And you sat in the same spot without any movement. She said, wow, that's interesting. And then she stood up and she said, I don't have any pain. Okay, very good. My skeptical mind, she's just trying to please me. So I made her climb upstairs, climb down the stairs, squat down. She had no pain. Bend forward, bend backwards, twist. She had no pain. She said, I have some mild heaviness, but the pain which was constant and nagging is not there. I said, well, auntie, I guess it's working on you. I will see you again in some days and we will have to repeat this because one healing won't be enough because you've been having it for chronic long time. Then I did not see her for a week. I saw her next Tuesday. That was a Tuesday that we healed her. I saw her another Tuesday and she said, whatever you did was magic. I have been able to sleep so well. And I still have some pinching spot, but the legs don't ache anymore. So I did the same healing on her. And this was one of my first healings 16 years ago. And then I healed her. And again, after a week or 2 weeks, she came back and she said, I've been very good. Then I did not see her at all. I told her, please come again because we should do some maintenance healing because it's been too long pain for you. She disappeared. So of course my mind says, old lady, maybe it came back. It was terrible. That's why she doesn't want to see my face anymore. Or gone, left the planet Earth. So that's why she's not coming anymore. And I put it out of my mind. 7-8 months after, we were doing an exhibition on pranic healing, and that was also in Vashi. And you have many stalls, and you have a pranic healers healing booth, and then many other small shops, sweetmeat shops, etc. So suddenly I was healing someone, and you suddenly turn back to look, and I looked at this lady buying something in a sweetmeat shop, like you have those dry fruits and stuff. I went back to my healing and I said, oh, that auntie is still alive. So I was so excited. I told my healing case that lady, I told her, please give me a moment, excuse me, I'll be back. I ran to that auntie, I touched her shoulder, and she was like, "Oh, you." I said, "What, oh, you? Where did you go? What happened to you?" She said, "No, I have no more pain." So my daughter, who has been calling me to Australia for a long, long time, called said, "Mom, now you can fly. You don't have any pain. You have no excuse." So she it seems spent 4 months in Australia, then went to her son to US for 3 months, and she just came yesterday, and then she realized that there is this exhibition and she wanted to buy a few things. So this was one of my first healing cases, which I almost thought did not work, and skeptically put it aside. And I always share this story because for a skeptic to witness something amazing, miraculous. After that, I've seen many cases where we could heal using pranic healing. Pain, definitely instantaneous relief we have seen, on myself, on others. Okay, swelling, inflammation, all those kinds of things can be healed faster. Cuts, wounds can be healed faster. Chronic ailments, say diabetes, heart ailments, arthritis, these take more time. Like you mentioned, psychosomatic, the word psychosomatic, many a time we have to use psychotherapy. Pranic healing also uses a kind of specialization by which we can work on the mind of the person. So we incorporate pranic psychotherapy along with physical healing, both, in a way, so we can go deeper into the person to work on the old chronic problems, right? So many times we have to administer the healing 3 times a week, twice a week. Sometimes it like very acute cases like appendix pain and all those kinds of things, you might have to heal every few hours in the same day to ease the person. Then you can either opt to go for a surgery or take other kinds of therapy. Many times I've seen that with healing, I had a couple of cases. This lady had a lump in her uterus, and it was so painful. So they wanted to operate her. So she called me and then she said, "Can you heal me? After 10-20 days, I have to go for this surgery. And I truly don't desire to be operated, but I don't have any other way." I said, "Fine." So she was in Kerala and I'm in Mumbai those days, and I would heal her at a distance. I will tell her at 10 o'clock, "I'm going to heal you." So she will lay down in her bed being receptive, and I would distantly heal her. I did not even see her ever physically. Even till now, I've never met her. But just on call, and then later on text messages. WhatsApp came much later. Then I would heal her. Almost I did 3 healings a week for 15 days. And she said the pain had almost completely gone. Sometimes she would feel it, but no. She was already in her menopausal state. So it wasn't connected to her periods or something like that. Now, the interesting fact was she went on the surgery, okay, and on the table the doctor said there is nothing to operate. She woke up after 7 hours and there was nothing more. She said, I was not operated. I was back home without a surgery. The doctor said there was no lump to remove. Now at this point, I would like Kshitij to add his viewpoint as a surgeon, and how he has used pranic healing in his career. Kshitij, would you like to talk to us? Thank you.
Thank you, Dr. Raghun, for your introduction. Now, before we start, I would like to make it clear that the approach that we take in pranic healing, just give me a moment, I'll share the slide. So the approach that we take in pranic healing is, the aim of pranic healing is not to replace allopathy or any other forms of medicine, but rather pranic healing is complementary. It's just similar to physiotherapy complementing orthopedics. They both go hand in hand, something like that. So pranic healing is supposed to work along with the existing therapies. We need to have a holistic approach. So every therapy has its own importance. Where allopathy works wonders, yes, it works wonders when it is needed. In my opinion, in all acute conditions and in all emergencies, allopathy is the treatment of choice. This is my opinion, of course. But for chronic conditions like Dr. Raghun was emphasizing, or what we call as non-communicable diseases, pranic healing works a little better. From the point of view of community medicine or from the point of view of allopathy, we talk about a concept called multifactorial causation. All these non-communicable, for example, hypertension. Now, according to medical science, hypertension, 90% cases is essential hypertension. The word essential implies that, the cause is not known. Now, the cause is definitely not within the physical body, but the cause is in the energy that surrounds the body. So the approach for such cases in long run is better using pranic healing. Now, that does not mean that the patient should not visit the doctor. The patient has to go to the doctor and continue with medications, but gradually over a period of time, his condition will improve. The need for medicines will gradually reduce. That is what we call as a healing happening. So, just to add a few more points in what Dr. Raghun has said, there is a concept of the energy. Let me just show the slide to you. Yeah. So this is what he was trying to emphasize. Yeah. This is the visible physical body where allopathy works on, or the modern medical science works on. And this is the energy that surrounds the physical body where pranic healing works on. Now, interestingly, most of the non-communicable diseases, they actually originate in the energy. So there are changes that happen within the energy on a long-term basis. There are changes that happen on a long-term basis. If the energy is affected for a long time, the dis-ease will manifest in the physical body. This is the principle behind pranic healing. So the approach for all chronic ailments is through the energy body. Now, we all, on a daily basis, we all take care of the physical body. We have a bath. We ensure that the physical body is healthy, clean. We ensure that we look good. But we really do not take care of the energy that surrounds us. If I have to show you a slide, a picture, and just think for a moment that if we all had the ability to see with our eyes the energy, if we had for a moment the ability to see energy with our eyes, then for most of us, this is what we would look like. So if you remember the earlier picture, the energy was much cleaner, but you can see here, this is what is dirty energy. This is how stress would look like, clairvoyantly speaking. Now, if this is the quality of the aura or the energy, then the physical body will tend to have will tend to fall ill, or will tend to repeatedly have illnesses, recurrent illnesses. So, on one hand, this is my opinion, allopathy for the treatment of physical body, pranic healing for the treatment of the energy. Now just think about this, that if you had a certain technology by which you could clean this dirty energy from the aura, you would make it clean, then the healing of the physical body, the physical health will improve many, many times. So allopathy for the physical body and pranic healing for the energy that surrounds, if both are used simultaneously, then the recovery of the patient is much faster. This particular concept applies to all medical conditions. For example, if a patient has acute appendicitis, an acute gangrenous appendix, definitely he needs to be under the knife. The appendix has to be out. But once the patient has undergone surgery, we all are aware of a concept called surgical stress. But the way we understand it as doctors, probably in my opinion, our understanding will improve with pranic healing. So simultaneously, if pranic healing is applied to the patient during the surgery and after surgery, then the changes that a doctor is expected to see in the patient on post-op day 2 or day 3, he would see probably those changes in post-op day 1. The healing is accelerated many, many times. That is what we mean by integrated approach. Now, how many of you have actually felt your energy? Or how many of you have felt your aura? Anyone here who has experienced? Would you like to? Because instead of making it just as a theory and talking in air and it doesn't make sense and just building castles in air, let's try to have a simple experience. Would you like to?
Yes.
How many are interested? How many? You can just raise your hand. How many would want to feel their energy? Okay, thank you so much. Thank you for your response. Let's do a small experiment. So the approach that we take in pranic healing is you do not have to believe in anything blindly. Like Dr. Raghun said, he was skeptical, and so was I. I always used to, before I came into pranic healing, I was a hardcore Newtonian. Newton came up with only three laws. I had my own another 3 in existence. And I used to think how to fit in. Anyway, let's do the experiment. Just press the center of your palms alternately. Just press. Just press the center of your palm. Alternately, gently. Press your fingertips. Make a tight fist. Stretch your fingers. Make a tight fist. Stretch your fingers. Now, just put your hands about 2 to 3 inches from each other at your chest level. Keep your eyes closed. Relax your hand. Relax your fingers. Inhale slowly. Exhale slowly. Inhale slowly and comfortably. Exhale slowly and comfortably. Inhale. Exhale. Inhale slowly. Exhale slowly. Inhale slowly. Exhale slowly. Inhale slowly, deeply. Exhale slowly and comfortably. Inhale very slowly. Exhale comfortably. Now very gently, very slowly, move your hands away from each other. Very slow, very slow. Move your hands away from each other very gently. Bring them close to each other. Delicate movements. Bring them close to each other. Move them away from each other. Bring them close to each other. Slowly, very slowly, it's not about the movement of the hands, but it's about the sensation that you have in between. Inhale slowly. Exhale slowly. Continue doing this. Slowly open your eyes. Okay, how many of you were able to feel something in between your hands? Some sort of a pressure or a force or some magnetic sensation? Yes. Would anyone want to share? Yes, please share.
You can type on the chat if you can.
Doctor, yeah, there was a definite, some sort of feeling that happened, doctor, at least to me. I could
Great.
make out when you inhale and exhale, and when the fingers went across with each other, I think there was some energy, yes.
Great. How many here were able to feel some sort of a magnetic sensation, some attraction, repulsion happening?
I did, doctor.
Okay, great. Anyone who was able to feel some sort of a force in between the palms? Yes, yes, yes. Anyone who felt some sort of tingling or warmth or a heat?
Warmth, yes.
Yes, warmth, yes. So what we were trying to feel was nothing but the energy that surrounds our hand or our palm. Now science says heat is a form of energy. Magnetism, pressure, force are none other than forms of energy. So every person here would perceive energy in a different way. Now there are, like Dr. Raghun was trying to say, there are techniques by which, using our hand, the hand is the best machine that God has gifted us. What your hand can sense in the patient, the same is true for even allopathy. When you palpate, when you try to feel what the hands can feel, the old dictum says, no amount of investigations can tell. That's what the seniors have been telling us. But sadly, these days we rely a lot on investigations. That's okay. From the point of view of pranic healing, what the hand can feel in the patient or within us, no machine can tell. There are ways to enhance this sensitivity to feel the energy, and like Dr. Raghun was trying to tell, there are chakras. The abnormality within the energy, the abnormality within the chakras could also be sensed prior, and then there are ways, algorithmic approach to heal, to make the abnormality normal. Once that happens, body starts healing itself. This is the approach as far as pranic healing is concerned. Why did I have to share all this? Because awareness of energy, it's necessary for doctors to learn pranic healing. It will help us become better doctors. It will help us deliver better care to our patients. Now just think, the last 2 years were tough for all of us. All the doctors at any point of time, even midnight, would get a call. Saturation is dropping. There is cough, fever. I don't know what is happening. Till morning or afternoon or evening, the patient was absolutely fine. No symptoms, but oxygen was around 92. The happy hypoxia concept. Oxygen was 90, 92, but no symptoms. Everything was fine. Now he's breathless. So the stressors in the last 2 years were much more. Now, if we as doctors become aware to a little degree of the energy, the aura that surrounds us, then point number 1, we can preventively take care of ourselves as doctors, de-stress ourselves and not get stressed out in times of pandemic. So that helps us maintain our cool. That also helps us with inner strength to go through the tough times, because our patients are dependent on us. So we have to maintain our hold. And that also helps us get our patients out. So just to show you a small picture, this is how an aura with negative thoughts and emotions, this is how the aura looks, an aura that has negative thoughts and emotions. And during pandemic, any patient, any known person, may not be a patient, any known person, relative, the only talk that we had was how many cases today. So we were all being bombarded with negative thoughts and emotions. So as doctors, it's time that we develop some awareness about the energy and energetic hygiene, similar to physical hygiene. There is a concept of energy exchange. So whenever the patient calls, the patient tries to release his anxiety, his fears, his stress, and ultimately the patient ends up dumping all of it on the doctor. How many of you agree with this? So doctors tend to be a garbage can emotionally. Physically, we try to take care. Physically, we try to wear a PPE kit, a face shield and whatnot. But what about the energy? So that took a toll on all of us. So it's time that if we introduce pranic healing in our lives as doctors, then we will be able to become better doctors and deliver better care to our patients. So I would like to hand over to Dr. Raghun for his COVID. Thanks. Thank you.
Thank you, Kshitij. Thank you, Dr. Kshitij. So I think you got a little viewpoint on the different probabilities as a doctor. I hope we have many doctors here today who are listening. As a doctor, you could be an effective healer, because I believe a doctor is not somebody who is only giving medicine. I remember as a kid, when I would go to my doctor, okay, till the time I'm outside, I'm cranky, I'm telling my mother I have this pain, I have that, I have this. The moment I'm inside the cabin in front of my doctor, I feel good. I feel very happy. How many of you experience that? Right? As doctors, do your patients also say that? Every time. That's why, there was this, I don't know nowadays, but doctors always were revered to be having God's hand above them, something like that, right? So true to that, if we have this concept of energy that Kshitij rightly pointed out, that if the doctors themselves, especially during this pandemic, what happened is so many of my friends stressed out. Some of them quit their jobs because they couldn't handle it anymore. One is pressure, one is the amount of hours that they had to spend in the hospitals. 3 is their bodies also got sick, so they couldn't function anymore. So coming to our day's topic, which is how did we handle COVID-19 and what could we do? So from the Institute for Inner Studies, which is the main organization for pranic healing, and we have master pranic healers who have been helming the whole pranic healing system throughout the world. There was this protocol that came out, which is a systemic approach on healing the cases. So I will just slide through few of these points so that you can understand what did we aim at and what did we come to. So even in the previous SARS outbreaks in 2003, we used pranic healing effectively in healing cases. In the current pandemic as well, we came up with these protocols. It was aimed at healing simple, mild, moderate, and severe cases. The main part of pranic healing was using advanced pranic healing. Like I told you, we have different levels of pranic healing. In that, we have advanced pranic healing, where we can go more specific using specialized pranic energy on the different systems of the body. So we used that as a healing tool. And under me, I had, like Mr. Vinod already mentioned, I had 40-45 healers almost working with me every single day. And I saw more than 900 cases in the last 2 years myself. I would heal them on the first time and then pass it on to a group of 4 or 5 healers. Usually what would happen in all these kinds of protocols is, suppose you have a patient in front of you, you would be the single healer treating that patient all the time. But in COVID-19, what happened was few things. Number of cases were more, right? Second, the progress of the disease was rampant and faster compared to the regular onset and duration of a case. 3, we did not know how is the disease going to culminate. There were rumors, there were suspicions. I'm talking about February, March 2020. It was completely new. So I remember March we started with these healings. I had a core team of 7-8 healers. I would heal morning, and I was locked up in US in my cousin's house. So I was royally treated by them. Morning, afternoon, evening, I would have 3 sessions at least, and lasting for about 3 or 4 hours. Yeah, so I would just take lunch breaks and some sleeping breaks, and we would work till late hours healing this case after case after case. And we would have many severe cases who would be so dependent on a ventilator in the hospital, from Peru, from Colombia, from Egypt, from Iran, from Mumbai, from Nepal, from Australia, from US. We had all kinds of people, all age groups. There was a case of a lady who was pregnant on her 7th month and severe symptoms. She had to be intubated and was on the ventilator, almost sedated with medicines, and then they were trying. So when we were healing, the patient who was referred to us, the lady who referred, she did not tell us she was pregnant. Okay, so we use a technique called scanning in pranic healing. So I looked at all the data and told my team, this is what is the case, and we have to start healing her immediately. So we gathered, and I was using the tools of scanning, and I said, I feel this woman is pregnant. So I said, anyway, let's start healing. And I sent a message to the referrer that, hey, could you find out if she's pregnant? I have a suspicion about this. So it took her 3 days to tell us that, yeah, she is 7 months pregnant. So why am I saying this is, we can pick up things which sometimes people don't tell us, including cases like even pregnancy. So it was astonishing. Many times I would know when the person is on the call and he's telling that my father is sick, and I would already ask the name of the father and start scanning. I would know that the right lung is more affected than the left lung. Things like that which are more critical. And then after a day or two, the X-ray would come, or they would go for a CT. Only then the reports would come. So like Kshitij said, that the doctors would palpate. We were always focused on palpation and the sensation of the doctor while examining the patient was most important at the bedside. But the gift of pranic healing today, if you practice it properly and regularly, you can pick up things that the patient don't speak. And many of my cases in the last 2 years were unconscious or coughing, breathless, or unable to communicate, right? So I had to rely on my senses. After a few days of healing, they would feel better and they would say, yeah, I had this. And I said, yeah, I knew you had this. So it has been a magical journey. Of course, we lost many people. I had many family members. A couple of them, we couldn't do anything. It was very severe. They were old. They passed away. But there were also cases who were clinically induced in a coma and returned back home after few months of regular healing and medical therapy. There have been cases where we could immediately start with pranic healing. Like I will quote a case of my brother-in-law. He immediately messaged me that I think I have COVID, and this was the first few months of the COVID pandemic, and probably around July or something he caught it, and then he had high-grade fever and he already started with breathlessness. So of course I told him, you immediately contact your local doctor and start with whatever medicines they're going to give you, and we started healing him. Third day, there was no more fever and no breathlessness on him anymore. His temperature chart was normal already on the third day, right? There are many such cases I could tell you. There are also cases where nothing worked. They went bad and then we couldn't help them anymore. There were cases where they had to be intubated after healing was still continued, and so various presentations. But percentage wise, let me look at my chart. I can tell you very, very clearly how much. 67% of our cases, of the severe cases, needed 2 times a day healing minimum and recovered fully. 67%. So that's a very high number of cases compared to of the severe cases. Not all cases were severe. Now, what is the most important message that we should take away? Use logic. Use logical approach. Don't think like some people said, oh, I am praying a lot, I will not get COVID. No, you have to still use all physical precautions. You have to wash your hands, wear masks. If you're in too close contact with people whom you do not know, better maintain distance, right? All that is important. Secondly, if you can learn something to increase your energy levels, then the possibility of falling sick is lowered. Number one. Remember, he showed you the image of the aura, right? If it is brighter and cleaner and stronger, then the possibility of falling sick is lesser. That is number one. If at all we caught the virus or got sick, not necessarily COVID-19, but anything, then the probability or the percentage of recovering is faster if your aura is bigger, stronger, cleaner. If you know yoga, if you know yogic breathing, do that. If not, learn pranic healing in your local pranic healing areas and centers. By learning that, even if you do the basic pranic healing course, it's a 2-day weekend course, it will teach you several things by which you can enhance your energy levels. Keep your aura clean. I'm just talking about self-healing, not even talking about healing other people. Like we would spend hours and hours healing, right? I would make it a habit that at the end of our sessions, we would heal ourselves too. Because if I am not there, what is the point of doing all of this, right? So self-care, healing oneself, taking care of ourselves is equally important while we stand as medical doctors or healers for others. So the gift of pranic healing is, one is the knowledge of energy, the concept of energy. Second is the ability to rapidly recover if possible, if not, at least sustain the health, right? Third possibility is preventive healing. For example, I would heal myself regularly, and I am sure I got exposed several times because I was in US, then I traveled to Europe, then I traveled to Mumbai, then I'm back now in Amsterdam. Definitely I have exposed myself many times, but I did not fall sick, right? Self-healing, increasing. Then every day we would meditate. We have a beautiful meditation called the Meditation on Twin Hearts, and this is a beautiful tool that we constantly have been using. Every night I have a group of people who would join me. Every night we would meditate, and then we will pray for the earth. We will visualize every person who is sick, who is not sick. We'll pray for everybody. And in turn, what we also do is we channel that positive energy, positive force, and healing power into our bodies as well, while praying for others, while asking for this healing to go to others, right? So it has been a great tool that during this pandemic, we have been successfully not just helping others, but maintaining our own health. That's something also I want to emphasize, including to my fellow pranic healers. Some of them are so others oriented. I think this pandemic also made them realize that they need to heal themselves, right? So pranic healing gives us that gift of healing others, but you can also go within, discover yourself, heal yourself. Doctor, heal thyself. Not just patient, heal thyself, but in this case, doctor can also heal. So just before our session, I had a call with another case, Omicron variant, Mumbai, and all the family members have it. So I was telling them the standard protocol of medicines and the supplements, vitamin C and all that, right? Then I told them one simple thing. They have not learned pranic healing, so I cannot teach them how to heal themselves, right? But this is something all of you can do, is take 5 minutes, sit down, and just take deep breaths. Inhale deeply, exhale deeply. Inhale deeply, exhale. Just doing that for 5 minutes, you start to replenish your body, right? So at this point, we can ask some questions and address some question and answers. Before that I would show you our contact number, that if you are interested to learn pranic healing or get healings done or more questions about these things, you can write it to Anuradha Nittur, our representative here, and this is her email address, anuradha2nittur@gmail.com, and her number is 8888913348. Okay, so or just contact Mr. Vinod and he would guide you. So let us take some question and answers at this point. Somebody asked me before, what is the difference between Reiki and pranic healing?
Yeah.
Good news is I used to be a Reiki grandmaster before I learned pranic healing. So I think I am a qualified person to answer this question. Reiki and pranic healing are similar in terms of energy healing, but the method and the technology that is used is different. Reiki was introduced in the late 1800s and early 1900s, and it's an older technology of healing using energy. Pranic healing is more of a modern technology. The methods, the vivified structures of administering the healing protocol is much more detailed, specific in pranic healing. That's the major difference. Otherwise, both use energy. Then, while talking about pranic healing, we have basic techniques, we have advanced techniques, we have psychotherapy techniques, we have even crystal healing, where we can use a specialized tool called laser quartz crystals and use them for healing. Especially when I was doing so many cases every day, it is good to have a specialized friend who can enhance your healing skill and energy. So we have such tools called crystal healing, pranic healing as well. So Master Choa, really and truly a genius. When I learned pranic healing, I was at awe because he knew medicine even better than us. Like Dr. Kshitij said, if a doctor becomes a healer, he would be a better doctor. And I thought Master Choa was a doctor because he knew the body so well. But actually, he was not a doctor at all. Just a genius who could bring together these two worlds, the physical and the energy world. And then there is no limit to the expansion of it, right? So let's ask more questions. Mr. Vinod.
Yeah.
This,
Thank you so much, Doctor. Yeah. I think there are some questions.
yeah, how to heal certain problems when there is no protocol like premature graying, excessive sweating, snoring.
Okay, this is a pranic healer who is asking us a question. Maybe you can ask me privately to give you this protocol. I can give you these protocols. Snoring, we have protocol. Sweating, we have protocol. Premature graying, also we have a protocol. I can give you the answer. Yeah, you can ask Mr. Vinod or Anuradha, and I can send you the protocol.
Sure. And somebody's asked that this is a question to us. I think, you can visit our Facebook page where the recording would be there of the session. And we will definitely not like to miss it. Please go and again watch it once again, because I think both the doctor, especially Dr. Raghun and Dr. Kshitij, have spent so much of time and energy. And this has been a really good session. You can go there and see. Any other questions, Usha?
Yeah, there is Mr. Shankar Swaminathan who has sent a message. Wish to ask doctors about pranic healing for a patient who has a vertebral fracture that is under natural healing. Can the healing be accelerated by pranic healing? He has acute pain in his hips.
Definitely it can be. Of course, I would like to know the age of the person. Older the patient, delay of healing can happen. Younger the patient faster. I will tell you a small example of this 23-year-old boy who came with a lower back fracture and also a knee fracture because of a sports injury. And within 3.5 weeks, he could jump 5 stairs again. We didn't ask him to do it. He did it on his own because he had no more pain and symptoms. But yeah, it could be that fast as well. Sachin Tendulkar healed his tennis elbow using pranic healing.
Wow.
Yeah,
great.
20 years ago. Yeah.
That's a great example, I think, to the millions of Indians. To the millions of Indians, Sachin Tendulkar is our cricket god.
Exactly.
Any other questions, Usha?
Nothing else, Vinod.
Okay.
There is
one more question which just came up.
There is one more question, Ushaji.
Yes,
My
sir.
friend whose grandfather is 85-year-old had urology issues and COVID took pranic healing, who also healed very fast. Oh, amazing. Oh, that's a sharing somebody has given.
Yes.
Oh, wonderful to know. Yes, Ushaji, the last question.
Last question. Just a minute, doctor. Can a heart block be managed using pranic healing?
Yes and no. If it is in a major artery and in a very critical position, and the percentage of block, both have to be looked at, and the lifestyle of the person. If the lifestyle of the person is more sedentary, bed rest alone can also restore a lot of the complications. But if they are stressed out and working, then you need to take care of that. Of course, with energy healing, we can work on the heart blocks. We have protocols for partial heart block, complete heart blocks, chronic cardiac disease, etc. So it can be healed. Like I said, lifestyle is important. Then the thought patterns of the person is also important. So when I heal somebody, I would also like them to reflect on, why do I have this problem? What is my heart teaching me? What is my cancer talking to me? What is this stone in my kidney telling me, right? So every disease tells us a lesson if we are open to learn. So yes, heart blocks can be healed.
Sure. Thank you, doctor.
That's it, doctor.
Yeah.
Thank you.
Do we have any more questions? No.
No, Vinod.
No, there's a 75-year-old who's asking how much time it will take to heal the lower back pain and leg pain. I think this is the last question, doctor. Can we take this?
Sure. It can be instantaneous relief to 80 to 90% of the pain on the first session, but it will come back because it's a chronic problem. So you will have to treat it again and again, okay, using pranic healing. Plus, you can use heating pads, massage maybe, or postural corrections. It could take you, say, a few weeks to be healed. Yeah,
Okay.
maybe 4 to 5 weeks. Okay. Now, suppose if there are too much of structural changes, like the disc has prolapsed, or there is a lot of deterioration, degeneration, then it can take longer, right? So we will combine psychological healing here if there is a lot of degeneration along with advanced pranic healing.
Thank you.
Parkinson's, can it be cured?
Parkinson's, yeah.
Yes.
I would say we could manage it. I had a 73-year-old case in Mumbai. I've known them for more than 12-13 years, and we have been able to manage him, including multiple sclerosis. We have been able to manage him. There are cases where they don't follow a single advice that we give, then it is very difficult to sustain treatment. Okay, so as much as you can cooperate, participate in the healing, faster the result. If you just sit and don't change anything that you are doing, you can pay me for the healing. I'm happy to receive all the money you want to pay me. No result. So it has to be, both ways.
Doctor, yeah. Thank you so much, doctor. Thank you. I think we have come to the end of the session, and I think this has been a wonderful learning experience, and also a sort of a healing experience in terms of our stressful lives that we all go through, doctor. To be very frank with you, I think it's been a very interactive session, and also for each and every individual. When you are talking about energy and aura, we didn't know that we all carry an aura. So that's something that without even being without being a celebrity, you're carrying an aura. So that is something that I like to pass on. And maybe Anuradha could help us out in Bengaluru. So I think everybody should know her email ID, anuradha2nitur@gmail.com. And of course, her number, which is 8889 133. Yeah, 13348. Yeah.
13348.
Yeah. 8889 13348. I'll just repeat it. So I think, as we all know, we thank Dr. Raghun so much for taking his time out and all the way from Amsterdam to share his time with us and also to be with us. And I thank Dr. Kshitij Nadkarni from Mumbai. And also, doctor, we might be even disturbing you, many of us. Please do share your email IDs. And we will be glad to at least get in touch with you on email, because I know, doctors, you have your hands full, and I hope this third wave will end, and I think we'll come to a close and let this pandemic be an endemic. So doctor, we all need that. Thank you so much, doctor, and for your time and this thing. And I thank all the participants today who had joined us, and it's been a great sharing and healing and energy experience that we all had. And please follow us on Namo Bengaluru Foundation. In those of you who are from Bangalore, and we welcome you to volunteer and also to attend our future webinars. Thank you so much. Thank you, doctor. Namaste.
I have shared my email there, pranamiracles@gmail.com. Yeah.
Yes.
So thank you. Namaste. Have a good night. Good evening.
Thank you, doctor.
Thanks, Anuradha. Thanks, everybody. Thanks, Kshitij.
Thanks, Anuradha.